Hello everyone. So today we are going to talk on excretory products and its elimination. 3 pointers which we are going to discuss today. 1. Micturition reflex. 2. Accessory excretory organs. And 3. The disorder parts related to excretory system. So now when we begin with the micturition reflex, the urine which has been collected in bladder, to remove it from our body is the process what we call it as a micturition reflex. So when we talk about micturition reflex, first let us understand the chemical composition of the urine which has been collected in the bladder. Because जब हमने फिल्टर बना के ग्लोमेरुलस में से निकाल के उसको बोमेंस कैप्सूल में लिया था, that was our primary urine or a deproteinized plasma, 99% of the which got reabsorbed in our renal tubules, and then finally through collecting duct coming into the ureter and into the bladder, that is our secondary urine or the urine which we eliminate. और जब मैं उसके composition की बात करता हूँ, 95% of the urine has been water and only 5% are the solutes, right? Obviously, solutes are organic, inorganic both, and in that, the major solute, as we belong to ureotelic category, the major solute is urea. Apart from that, even we see salts, ammonia in traces, hippuric acid, or even a water-soluble vitamin such as C in urine at times. Urea, it is said that human body eliminates about 25 to 30 gram per day. The amount of urea eliminated from our body is about 25 to 30 gram in a day, because in a day we eliminate about 1.5 liter of urine, about 1 to 1.5 or maybe at times 2 liter of urine, because the amount of urine eliminated per day depends on 3 major things. Number 1, the physiological condition of the body, which is based on your water intake. Number 2, diet, and number 3, physical activity. So the urine which we have eliminated, which is about 1.5 to 2 liter, when I look at its specific gravity and the pH, the urine which has a specific gravity of 1.003 to 1.040, that means obviously because of the solute it is slightly more than the water, with the pH of about 6, and it is definitely hypertonic compared to that of our blood. Definitely seasonal environmental condition के हिसाब से color of the urine will definitely vary based on the physiological condition. At times in winter season we see colorless urine, but at the same time in normal condition, or I would say in summer, we see pale yellow to dark yellow color urine, and that pale yellow color of the urine is because of the pigment that is urochrome. That urochrome pigment gives it a color and the odor. When you allow urine to stand or we haven't flushed it well, that gives a urination, gives a pungent smell or a characteristic smell. That is because of the breakdown of urea into ammonia due to bacterial degradation. Right? So the odor is because of this, and the color is because of the pigment urochrome. Apart from this, human blood or human body allows or contains 17 to 30 milligram of urea per 100 ml of blood. This much amount of urea is normally present in our blood to maintain the osmolarity of our blood, osmolarity of our body fluid. So these are the MCQ point, key MCQ point. इतना यूरिया हमारे बॉडी में नॉर्मली प्रेजेंट होता है. And as I said earlier, this is the amount of urea per day. This is 25 to 30 gram per day what we eliminate from our body, right? So that is with respect to the composition of urine which has been collected in our urinary bladder. So now when we talk about what role or how the reflex works to remove this urine from our body. So now when I talk about the voiding of urine or a micturition reflex, it is said that about 150 to 200 ml of urine जब urinary bladder में collect हो जाता है, that gives a sensation of fullness because of the stretch receptors present on the wall of the bladder. Urinary bladder wall जो हमने डिस्कस किए थे, 3 layer, outermost connective tissue, middle one smooth muscle and innermost transitional epithelium. The smooth muscle present in the wall of the bladder is specializedly called as detrusor muscle because it has a slightly distensible property. So, जब यहाँ पे 150 to 200 ml का यूरिन कलेक्ट होता है, we get a urge for urination, and that is because of the stretch receptors. So, from here, the stretch receptors send signal to our higher command, that is to our CNS. Okay, so I repeat. Bladder containing 150 to 200 ml of urine activates stretch receptors present in the wall of bladder, which in turn sends signal to the CNS. And now what CNS will do, CNS in return sends motor signal to number 1 muscle of the bladder and number 2 urethral sphincter. Okay, so though it is said that bladder can hold up to 600 ml of urine without any irritability, or it can extend up to 800 with a little bit of pain and irresistance desire to void or to urinate. But at the same time, यहाँ से जब stretch receptor से signal मिला, if you observe over here, the structuring of the sphincter, the internal sphincter becoming a part of the trigon, and the external sphincter, which is our striated muscle structure. So internal sphincter तो 600 ml पे ही give up कर देगा, but still external sphincter will try to hold up to 800 ml. But now when the signal has come from the CNS, the wall of the bladder will contract. The wall of the urinary bladder will contract. At the same time, the sphincter muscle relaxes, allowing the passage of urine. Again, I would say here it is a parasympathetic stimuli which is coming. I repeat, for voiding, for micturition, parasympathetic stimuli comes which contracts the smooth muscle of the bladder and relaxes the urethral sphincter muscle, allowing passage of urine. And that's how micturition takes place. Micturition, अगर हम उसको reflex बोल रहे हैं, definitely initially in early stage of life, it is like an involuntary, and that's the reason you see the cases of nocturnal enuresis or a bedwetting. But over a period of time, it develops as a conditional reflex, and that remains throughout the life. At the same time, due to certain disorder condition, person loses the control over the sphincter and involuntary micturition takes place, involuntary voiding of urine takes place, and that's what we call it as a incontinence. That's what we call it as incontinence. So mainly due to prostate gland disorder or some neurological disorder जहां पे आपका ये nerve control damage होता है and a person suffers from incontinence of urination. So now when we talk about the accessory excretory organ, definitely kidney is my primary excretory organ, but apart from that we have 3 more accessory or a supporting excretory organ जहां से भी metabolic waste remove होते हैं, that is lungs, liver and skin. Skin containing sebaceous and sweat gland also helps in removal of metabolic waste. a very important MCQ part because ये पैराग्राफ हम यूजुअली मिस आउट कर देते हैं और यहाँ पे MCQ में हम मार्क्स गवाते हैं. So look at this part of NCERT carefully. That lung which removes, as we discussed in initial definition of excretion, CO2 भी हमारा एक metabolic waste है, and obviously lung is going to help us in removal of that CO2. So lung which removes about 200 ml of CO2 per minute. So that is a significant quantity along with the water vapor which lung removes from our body. Now coming to liver, which is the largest gland which secretes this bile pigments, that is bilirubin and biliverdin, along with cholesterol and degraded steroid hormones as well as vitamins and drugs. So liver, when it removes all this through the process of egestion में stool के साथ ये सारे metabolic waste को remove करता है and it helps in excretion. Right? So bilirubin, biliverdin, cholesterol, degraded steroidal hormone, vitamins and drugs are also metabolic waste removed by the liver. And coming to the sudoriferous gland, that is sweat gland. Why do we call it as a sudoriferous gland? Because उसका major काम हमारे body temperature को control करना है by evaporation of the sweat. And when we look at the sweat, which contains not just water but also small quantity of urea and lactic acid along with salt, that is NaCl. So sweat gland may be small quantity of urea you will find. And coming to the last, that is sebaceous gland. That's a oil secreting gland which releases sterols, hydrocarbon and waxes through sebum from our body. So these are three very important accessory excretory gland, and you cannot miss out the MCQ from there. So that's about accessory excretory gland. Next, we talk about the disorders related to excretory system. So now when we talk about disorders related to excretory system, three major disorders we will be talking about. That is glomerulonephritis, renal failure and renal stone or a nephrolithiasis. इसके अलावा cystitis, urethritis are also related to urinary system. We will brief about them. बाकी जो भी terminologies है, they are not the disease, they are the symptoms or a sign. For example, polyuria, hematuria, ketonuria, glycosuria. So these are all conditions which occurs because of the disorder. About them we'll discuss further. So let's talk about first glomerulonephritis. So when I say glomerulonephritis, as the name suggests, glomerulus-itis inflammation. So this is a condition which occurs most commonly due to infection. It has been said that streptococcal infection, which usually affects our throat causing tonsillitis, but when a person suffers from repeated tonsillitis, he may suffer from glomerulonephritis or any kind of an infection through urinary tract if not treated. मतलब अगर cystitis या urethritis को अगर हमने timely treat नहीं किया, it can cause glomerulonephritis. और जब हमारा glomerulus affect होगा, हमारे वो component blood के जो normally urine में present नहीं थे, जो filter out नहीं होते थे, that is protein and blood cells will start getting filtered out because आपका glomerulus, आपका Bowman's capsule damage हुआ, तो हमारा ब्लड सेल और प्रोटीन भी ब्लड फिल्टरेट में आने लगेगा और उनको तो रीअब्सॉर्ब करने की कैपेसिटी है नहीं, एबिलिटी है नहीं, एंड दैट्स हाउ वी विल स्टार्ट लूजिंग दोज मॉलिक्यूल्स फ्रॉम आवर बॉडी. सो ग्लोमेरुलोनेफ्राइटिस में अगर आपको सिम्टम्स जो देखने मिलने वाले हैं वो मेजरली होगा प्रोटीन यूरिया और प्रिसाइसली अल्ब्यूमिन यूरिया एज वेल एज हेमेचूरिया. That is blood cells or RBCs in urine. Along with that, you will also see the symptom of WBCs in urine or pus in urine. We call it as pyuria. So this would be your major signs and symptoms of glomerulonephritis. Treated with antibiotic, but if not taken well care, person may lose his kidney permanently and may require a dialysis or a kidney transplant later on. So that is about glomerulonephritis. Now when we talk about renal failure or a kidney failure, obviously we have heard a lot about dialysis, but वो dialysis तक person पहुंचता कैसे है? The condition is renal failure. You might have come across a case कि 3 दिन का बुखार था, हॉस्पिटल में एडमिट किया, सही से ट्रीटमेंट नहीं मिली और उनको डायलिसिस पे डाल दिया. So it's not about sahi se treatment nahi mili, but a person might suffer from acute renal failure. It is not always that kidney gets damaged slowly. It may happen that due to severe infection or some kind of a traumatic injury to the kidney area, person may suffer from immediate renal failure. So we divide kidney failure into two categories, that is ARF and CRF. That is acute renal failure and chronic renal failure. So basically what is happening in this renal failure situation? आपका किडनी अपना फिल्ट्रेशन का काम सही से नहीं कर रहा है, बिकॉज ऑफ विच आपके बॉडी में, आपके ब्लड में नाइट्रोजनस वेस्ट का कंटेंट बढ़ेगा, यानी कि यू विल हैव मोर ऑफ यूरिया, you will have more of creatinine. This too will be majorly increase in your blood, affecting your normal physiological condition of the blood, functioning of the blood. When you have a higher urea concentration, the condition we call it as uremia. As I said, uremia is not a disease. It is a condition which occurs due to renal failure. So जब आपको यूरेमिया, ब्लड में यूरिया कॉन्सेंट्रेशन 30 मिलीग्राम पर 100 ml ऑफ ब्लड से बढ़ रहा है, मेटाबॉलिक एक्टिविटी विल बी अफेक्टेड. अब मुझे कैसे पता चलेगा मेरा किडनी सही से काम कर रहा है या उसमें कोई डैमेज हुआ है, नहीं हुआ है? द गोल्ड स्टैंडर्ड टेस्ट to check the kidney function is to check your blood creatinine level. It is said that हमारे ब्लड में क्रिएटाइन का लेवल 1 मिलीग्राम पर 100 ml से कम होता है. The moment it increases, the moment kidney shows slightest damage, immediately creatinine level will shot up. As we discussed, creatinine is your no threshold substance, यानी कि आपका बॉडी उसको कहीं भी ब्लड में नहीं रखना चाहेगा, उसको निकालने के लिए एनर्जी भी स्पेंड कर देगा, राइट? बट अगर उसका कॉन्सेंट्रेशन बहुत ज्यादा है, थ्रेशोल्ड से ज्यादा है, then definitely उसका ब्लड में कॉन्सेंट्रेशन बढ़ेगा, and that gives you an idea about the kidney health, and accordingly you can take a treatment. When I say chronic renal failure, which occurs mainly due to a illness such as long term Diabetes Mellitus और long term hypertension kind of a situation. अगर कोई इंडिविजुअल को बहुत लंबे टाइम से 10 साल 15 साल से हाइपरटेंशन है और अगर वो वेल कंट्रोल्ड, वेल मैनेज नहीं है, person will definitely move towards renal failure. Or even a diabetes, if it is not well controlled, a person will move to renal failure. The reason is hypertension और diabetes जैसी कंडीशन में आपके ब्लड का विस्कोसिटी बढ़ रहा है, आपके ब्लड का कंपोजिशन चेंज हो रहा है, एंड किडनी के ऊपर उसको प्रेशर आ रहा है टू रिमूव, एंड ग्रेजुअली योर ग्लोमेरुलस एंड द Bowman's capsule get start damaged in case of hypertension, and you will suffer from renal failure. It is said that जब तक हमारा 75% नेफ्रॉन completely damage नहीं हो जाता, हमें शायद पता भी नहीं चलता है कि हमारे किडनी के साथ हो क्या रहा है. And then person has only one choice left, either put on the dialysis or treat kidney transplant. About that we'll discuss further, but understand over here, हमारा blood a particular level of glucose को filter out होने से रोक सकता है, यानी कि किडनी में there is something called as renal threshold. जब मैं ये renal threshold की बात कर रहा हूं, ग्लूकोज जो मेरा हाई थ्रेशोल्ड सब्सटेंस है 180 मिलीग्राम पर 100 ml ऑफ ब्लड, मेरे ब्लड में इतना ग्लूकोज का कॉन्सेंट्रेशन होगा तो नेफ्रॉन उसको कंप्लीटली रीएब्सॉर्ब कर देगा. बट जब इससे ज्यादा ग्लूकोज लेवल जाएगा, किडनी आई मीन टू से नेफ्रॉन उसको रीएब्सॉर्ब नहीं कर पाएगा, एंड डेफिनेटली आई विल हैव अ सिम्पटम ऑफ ग्लाइकोसूरिया as well as ketonuria, which are initial signs that I will be going for a chronic renal failure. So it is very important to understand kidney, one of the very vital organ of our body. अगर उसको सही तरीके से मैनेज नहीं किया गया, परमानेंट फंक्शनल लॉस होता है. एंड व्हेन वी से किडनी का फंक्शन लॉस हुआ, तो सिर्फ एक्सक्रीशन और ऑस्मोरेगुलेशन ही लॉस नहीं हुआ, हमारा erythropoiesis, vitamin D production, pH balance, everything is for toss, right? So that's about the function of kidney and a renal failure. Now coming to renal stone or a nephrolithiasis. So now when I say renal stone or a nephrolithiasis, kidney stones are normally goes undiagnosed for a long time, because जब stone वो kidney के अंदर होता है ना, तो शायद पेन भी नहीं होता और पता भी नहीं चलता. It gets detected on a sonography accidentally, कि आप किसी और कंप्लेन की वजह से सोनोग्राफी करवाने गए और पता चला किडनी के अंदर stones है, which are painless, no treatment required. But definitely when this stone descends down into the ureter, it causes unbearable colicky pain, a severe pain where patient just tosses up in the bed. Matlab, you cannot imagine the pain what kidney stone or ureteric stone person will suffer from. It begins from the back of the abdomen and then it descends down into the pelvic region, a radiating pain. So now the question is, stone bante kiske hai? So basically these are the crystal stone, most commonly of calcium oxalate. इसके अलावा आपको यूरिक एसिड क्रिस्टल्स भी मिल सकते हैं, या स्ट्रूवाइट जो एक यूरिया स्प्लिटिंग बैक्टीरिया की वजह से बनता है, स्ट्रूवाइट स्टोन्स which is very common in patient with uncontrolled diabetes. But most common what we see are the oxalate stones, which are formed because of the lack of water intake or poor water intake condition. When the stones are present just in kidney and small in size, you may not require any treatment. But if there are multiple stones and chances are there, it might descend into the ureter, you may require a lithotropsy kind of a treatment or a surgical removal. And if it is there in the ureter, based on the size and the location of the stone, doctor might advise you to have a hydrotherapy, increase water intake like even nariyal pani or a barley water, and get stone removed from your body, from your urinary tract naturally, or again lithotripsy or a surgical removal might be required. So that is with respect to excretory system disorder. Few more terminologies like proteinuria, hematuria, ketonuria, glycosuria. Let us understand them. So these are certain terminologies which we use with respect to urination or urine conditions. Like we already spoke about, proteinuria, increased protein in urine. Normally urine में protein नहीं होता, but अगर glomerulonephritis जैसी condition, renal failure जैसी condition है, uncontrolled diabetes जैसी condition है, protein will be found in urine. RBC in urine, urine turning out to be red in color or red stringent color because of the presence of RBC, hematuria, again indicating towards damage to the glomerulus. Ketonuria, glycosuria, as we said, connected with a condition of diabetes mellitus. Dysuria, that is painful urination. Urinary tract infection, conditions such as cystitis, urinary bladder का अगर infection हुआ है, painful urination होगा. Urethra का infection हुआ है, painful urination होगा. So that will be initial sign, painful urination with burning while passing the urine. Dysuria. Anuria, no urination. Now again, अगर हमारा blood pressure low है, as we said, NFP कम हो जाएगा, urination में problem होगा, या फिर kidney, nephron में ही कुछ error है, damaged है, anuria. Now, when you suffer from anuria, ultimately you will lead to uremia. आपके blood में urea concentration बढ़ेगा. यहाँ पे हम जब बातें कर रहे हैं, we are talking purely with respect to urine. Uremia is a condition जहाँ पे आपका blood affect होगा. Polyuria, increased frequency of urination. Oliguria, less frequency of urination. Oligo, few. Poly, many, more. So more urination, polyuria, which is again a sign of diabetes insipidus and diabetes mellitus. More on this disorder in the hormonal chapters. Oliguria, less urination. Diuresis, quantity of urine is more. So you can say diuresis and polyuria are very much connected to each other. Whereas enuresis, or I would rather say nocturnal enuresis, in voluntary urination, or I would say bedwetting condition, enuresis. So these are the terminologies which are associated with a disorder or abnormality with respect to urine. So that's all with respect to chapter excretory products and its elimination. For MCQs, we will have a separate discussion for key MCQs from this particular chapter. All the best.